mentors and great teachers really guide your way, whether knowingly or unknowingly. Public institutions also make healthcare accessible and affordable to people. So that's a major pro. If done right, the day takes a turn on its own. And then you wear the mother hat, and then you wear the professional hat, clinician, and then you wear the wife hat and the homemaker. And, and today I was just thinking, oh my gosh, we do a lot. Like, can I just put one thing to rest first? But we can't. But God gives us the grace to do that. Yeah.
Hi everyone, thank you for joining us once again on Knowing Your Medical Maestros. Today we have a very special guest. She's a lady and we'll let her introduce herself. So thank you very much for joining us today. Maybe you can introduce yourself to our viewers.
Thanks for having me. My name is Dr. Caroline Mithi. I'm a consultant physician, endocrinologist and diabetologist, and I'm also an obesity fellow.
Very nice, Carol. So maybe before you can tell us about your academic journey, how you even came to being an obesity specialist.
Primary school, I have to say that I had a privileged background and I gave that and owed that to my parents. So I went to primary school, Thika Road Academy. Then I did my high school at Mary Hill High School in Thika. And then I did my Bachelor's of Medicine and Surgery at the University of Nairobi. I did my internship in Gatondo, went to Thika for Mentorship, or what you call to be a medical officer. And then I came into Aga Khan University Hospital in Nairobi and I did my internal medicine. From there, I did a fellowship in endocrinology and diabetes from the University of South Wales in the UK, and now pursuing an MSc obesity from the University of South Wales in the UK.
Impressive. So that has taken you roughly how many years?
Almost 17 years. Still schooling. 17 years of medical school.
That's
yeah, not actually counting my primary and high school. So that's just since I got into University of Nairobi to study my medicine. I think if I'm to count since I started school at 2 years or 3 years, that's like 33 years. Yeah.
Wow, that's such a long time. And it's actually, I think people would underestimate the kind of work and time it takes to be a specialist. But I would like us to maybe delve into your medical journey and career and academics in terms of from University of Nairobi and now I made University of Wales and all that. So how has that journey been in terms of challenges and what it took for you to actually be there?
Let's start with undergraduate. I think you come into undergraduate quite young. You really don't know what to expect. You're thrust there. Because you got good grades, but also my mom tells me I had the desire to become a doctor. And so got in there. Undergraduate was, now looking back, it was like a blur. It was moving the motions. And thankfully, and I am proud to say that I actually graduated summa cum laude. So what that means, but at the end of school, I was actually called in to receive awards or recognition that I was the best student in that year. I think it was 2013, 2014.
So like a valedictorian sort of. That's nice. Yeah. It's very impressive.
So for several awards for the Bachelor of Medicine and Surgery, that was quite humbling, I have to say, because sometimes, and even the people who are in medical school right now, you almost feel like you don't know what you're doing, and just going through the motions. But at the end, it paid off, right? So my undergraduate was difficult. difficult, but also quite a journey because also you're becoming, you're getting to know yourself. I think my medical astuteness and knowledge now came in postgraduate at the Aga Khan University Hospital, where now you're very clear in your mind what it is you want to do. Great mentors, great teachers there, and I'd say that is where really my grounding of medicine got formed. After that, then did the fellowships in endocrinology, diabetes, and now obesity. And now as we go along, then I'm very clear in my mind what it is that I want to do and what I want to become and get into this space. So it's a journey. You always start out not knowing, but I believe in the leadership and guidance of God. That somehow your purpose will get revealed on your journey as you go along.
It's impressive that, you know, when me from a social background, like when I started my first year of school, like, to be honest, I was just clueless. And someone would think, like, since you've done medicine, like, you kind of know, this is not what I want to do. Kumbe, it's something that just cuts across all discipline. It's just not just medical world. And that is something that people maybe also need to like learn, that it's and be aware of that it's just not your engineering part or your social science or your biochemistry. It's something that is just all round, which is quite comforting.
That's true.
You figure it out as you go along. Yeah.
I have a question regarding you took the route of endocrinology. So why endocrinology specifically amongst all the other options of internal medicine? Why that one? Is there a story behind that?
Mentors and great teachers really guide your way, whether knowingly or unknowingly. So I had a brilliant teacher who's also a mentor, Dr. Kunyiha, and she embodied the person or the kind of person you'd want to be. And even in your youngest, the kindness, the firmness, the knowledge, and just looking up to her and just like, I'd actually want to do that. But also I remember she'd take some few moments of her day to just sit with us and sit with me specifically. I think I remember, just asking about my personal life, right? And then subsequently, then other teachers and mentors, Dr. Eric Njenga, I always tell him, he opened the door for us for endocrinology. And it's worth mentioning such people who've really paved the way for your career. And so for me, during that time, I found myself basically drawn, but I always believe, I'm a firm believer that God ordains your way in the sense that brings opportunities your way and you find yourself there. And for me, really, how I got into endocrinology was by chance, but now that I'm in, I'm just like, this is what this is where I belong. I love it. I don't see myself doing anything else. Yeah, but if you'd asked me that when I was starting medical school, I probably didn't even know what endocrinology was.
Following up on that, just for the benefit of our viewers, what does an endocrinologist do?
So an endocrinologist is a specialist who deals with hormones in the body. Most of us are known as diabetologists because we know about diabetes, but basically all the hormones in the body. And now endocrinology is encompassing now obesity management. And so basically I'm a specialist for hormones in the body.
I think that helps to clarify
the complexity of human beings and women. It's very interesting. So maybe you could tell us a little bit. So you've gone through this mentorship and all that. How would you say what was the most difficult bit about medical training?
So one of the challenges of medical training, one just from the undergraduate, is lack of guidance per se, and there's that feeling that you're almost on your own and figure out and chart your path. The mentorship part came very boldly for me in my postgraduate because we were fewer in the class, and people were willing. So I think mentorship is one thing that comes very big, especially for the students who are embarking on medicine. The other challenge I'd say is the time. We underestimate how much time goes
The long hours.
into medicine and medical training. It's time consuming, it's gruesome, it's hard, it's difficult, but it's doable.
Did you at one point feel like, especially the first 2 years, is it first year or 2 years where you do anatomy, did you feel like, let me just stop this thing, I leave? Like, this is not what you really wanted? Was there a point you just wanted to quit? Or you just kept on because, this is the path I've chosen and I want to be a medic?
Well, so I didn't have that luxury to think about quitting, and then you do what? How do you go back to your parents and say I'm quitting? And then, so I didn't have that luxury of even thinking about quitting. However, in my postgraduate, in first year, I thought about quitting like after every call, like every week, just like, and then you pick up yourself. So undergraduate, I didn't have that luxury, but then in postgraduate, it was very clear. It is hard. Long
hours.
Failures. And I tell this even to my residents. Residency is hard everywhere, whether you're in the country or outside the country. The training to become a specialist is difficult, right? And so I'm a firm believer of doctors, specialists should be paid their work, right? Yeah. We put in the hours for sure.
True.
Right.
Maybe we can tell that to our government, it should. They should watch this, they now understand what it takes.
And beyond now, the hours, you've mentioned the hours are gruesome. It's also very strenuous and it takes a lot of you. So what coping mechanisms did you acquire so that you are able to persevere and go through? What are the tricks and things that helped you walk through this journey?
One, community around you, getting people, friends around you who would actually be there and support. So I had a wonderful community of people around me. Two, my faith. I'm a person of faith, so God, and just imagining and thinking that there's a reason I'm here. It may not make sense now, but let's push it. And now, 17 years down the line, I'm just like, there's a reason, and I'm enjoying it. But you have to go through the process. So faith and God and my Christian community really carried me through the time there. And I have to say that other people get different coping mechanisms. Some doctors will go into alcohol and other substance abuse and use, and it's an unjudgmental place to be because you have to find your clutch. You have to find what copes, and that's why I think mentorship, especially for the younger people getting into first year and second year, getting people who can take them and say there's a different way. It is hard, but you can do it.
And do you think that's something that maybe needs to be told in medical schools? Because I'm seeing we don't have a lot of mentorship program for the young medics. So is it something that needs to be preached, or programs coming up? Because in all honesty, you find a medical student coming out of school, then they just get lost into spaces that maybe they're not aware. And is it something that maybe, I don't know how I'd put it in terms of maybe come up with programs, because you people are experienced, and maybe it's something to partner as well.
Like it should be like a
mandatory thing, yes.
Like training.
I think it should. I think a mentorship opportunity should be given to every student who's coming into campus, and even not necessarily medical school. And that's because you're just getting out of puberty, you've just left home, it's probably your first time out of home. And you almost clutch to whoever comes first. Yeah. And so just getting someone to mentor us, having mentorship programs in school, then that will really help. So I agree. I think it should be in the curriculum, almost imposed on us. But also on the other hand, then you'd have to have willing mentors. And I'm very passionate about mentoring ladies and young girls, because then you're able to catch them early. Yeah. And before their mind is formed. So I think it's time to introduce
one of those, you know, when you leave campus, you're like, computer. Right. You know, like, what is driving school? So I think it should be mentorship, you know, like one of those things that you do. But it's a nice, being in this space, I would say it's very interesting, and it's, something to learn. So maybe just as a follow-up question, if you were to give advice to the young students, what would be that one thing that you would tell them?
One, be excellent in what you do. Exert yourself to the best of your ability, but also get a wonderful community around you. And I mean, I preach faith. God really in this. Yeah. Ni God man. Say by the way, true. For sure. It does. It does. Yeah.
Just before we move out of that space, I've always wondered if medical students get what is it called, like counseling? I don't know if, because mental wellness and medicine, I feel need to go hand in hand, because you have the long hours, you're meeting patients, and there are people who are not happy. They need you. They need you at your best, so it drains you. Do you feel there's a place for mental health awareness counseling that should be involved in these spaces?
I think there is that space for, and there should be, for counseling, one, to expose you to what you should expect, but also to be able to you go through grief, and that's part of medicine, and it really takes a hold of you, and most of us really just, sweep it under the carpet, and just imagine that, you have to move on. The world is not stopping, there's a call, there's whatnot, and so you find that you're actually putting it all, and so you can snap and break. And so the point of counseling and therapy and just decompressing should be offered to the students, but also the professionals who are currently coming out.
The way it is, people find it very difficult, like going for counseling, because they feel overwhelmed and they have a mix of emotions. Is there a way that this can be preached? Because most medics don't want to be seen as nimelemewa, so wacha tu, counseling is not my thing. And to some point, it should be like a mandatory thing. Are there institutions, like when you were doing your internal medicine at Aga Khan, did you have sessions you would go to, ama ilikuanga tu kujipanga we peke yako?
When I was in residency, I think there was a counselor provided for us, but honestly, I didn't utilize that. And that's just because of the busy schedule that we had. It was hard to take an hour out to go pour out your problems to someone. And then, who'll do your work? But that was a wrong way to view it. And so hence the getting other different quicker mechanisms, to sort yourself. However, I think it should be given and it should be provided that there is a therapist and a counselor on site. It's not a sign of weakness to actually go and talk it out and just get ways and other ways to cope. But also, even now getting into the medical field, there has to be ways where we get, counseling and therapists available, even for the healthcare professionals in our different institutions, but also privately. And I like that now, since the COVID era, we have embraced also virtual consultations, virtual therapy sessions, so you won't really have to face the person, but you can actually just do it virtually. What we need to do is to make it affordable and accessible for people.
Okay, and do you think it should be part of your orientation? The way you have your internal, like is it something said that we have this, you can be able to go or during orientation it's never even mentioned?
No, it is mentioned.
It's mentioned.
During
Okay.
orientation, but that time you're like, who will need it? I'm going to wing it. Yo, let me tell you. Hi.
It hits you hard
Where-
later.
Yeah, and yeah, but I think maybe one way to do it is to carve out time. Yeah, to carve out time to say this is, almost like in high school, this is a period where you can have a session or even just bring the counselor to the people. Yeah, so it is given during orientation, at least in the university that I went to. But then I am aware that in other places and other universities, they don't have this privilege. And so it is to offer that to them. Yeah.
I think I have a very curious question.
Yeah.
You mentioned that you had been going through your residency at Gatundu?
Internship.
At Gatundu.
Yeah.
And so you walked the journey between a public institution and a private institution. What were the challenges and what were the wins on either side? So maybe you can start with the public.
Yeah.
Just to have it out and, maybe prepare for someone who's going on the journey or even create awareness on it. Yeah.
Right. So for public institutions, one, they give you, especially coming out of med school, they give you the exposure because then you have a wide array of cases and symptoms to see, but also it gives you the hands-on experience. And so for anyone coming out of med school, I'd highly recommend that you actually go to a public institution and do your internship and then now you figure out whether you want to come into private, and that's because you'll get your hands-on exposure and you'll see the wide variety of cases. And while you're there, exert yourself because it's just 1 year of learning. And so public institutions also make healthcare accessible and affordable to people. So that's a major pro. If done right, and I've been in institutions where they do an excellent job. And so it's just a call to the who is who to fund, because if done right, then it works, especially for the majority of people. And same with private care and private institutions. I mean, they've mastered, especially the private institutions that I've been to, they've mastered excellent care, international world-class care that we can access in Kenya. And we don't take that for granted. I was privileged to train in that center, in such a center. And it really formed the subtle things that I pick up, certain things like empathy, kindness, how you talk to patients, etc. You may not necessarily pick that out in other institutions, but that was something that you rubbed off on you. But regardless of whichever institutions you go to, you train in, you're treated, or you treat in, several values work with me and with a should for everyone. So empathy, care, the same way you talk to patients in one side should be the same way you treat the patients should be the same, because the only difference really is their capacity to be able to access that care. And so we shouldn't be able to discriminate patients depending on where they're seeking care. And so I'm a firm believer of kindness and empathy, and put yourselves in that patient's shoes.
That's lovely. Okay, I think now we can move on to maybe tell us how your day is, a typical day as a medic.
Okay, so I'd wake up some minutes to 5 a.m. At 5, then I'd do my quiet time, and then I'd go to the gym. So I do a 30 to 45 minutes workout in the gym, and then I'd come home to wake up my children. I always want for them to be the first person they see. And so we'll have breakfast with them. That's around 6:15. We'll have breakfast with them, and then I'll drop my son to school, and then now I'll come into work. And so just really spend my day either doing ward rounds or doing clinic, and then in the day just passes. In the afternoon, then I'd go home, be with my children as they do their homework, have dinner with them, and then put them to bed. And so in the course of the day, you wear like almost 3 hats.
Yeah.
Oh, and then I have to say, after the children go to sleep, no, you have your time with your husband or with my husband.
Yeah.
And so it almost seems like you take care of yourself first. And that's why it's very important for me to do my workouts in the morning before the day starts, because the day takes a turn on its own. And then you wear the mother hat, and then you wear the professional hat, clinician, and then you wear the wife hat and the homemaker. And, you know, I mean, and today I was just thinking, oh my gosh, we do a lot. Like, can I just put one thing to rest first? And but we can't. But God gives us the grace to do that.
Carry it with grace. So I think it's a good thing, and it's very inspiring to hear your journey and how you've come. And to be honest, you have a very beautiful space, which I think we will get into that much later. It is very beautiful. So I think maybe the one thing, maybe, I don't know if it's been mentioned, or like, what were the key turning points in your career?
I mean, one is getting into med school, right? And the fact that, you know, with God's help, we got the A grade. And I'd say that was one pivotal moment, because then it pivots you into what you'd want to do, getting into med school. But two, getting into internal medicine. That's at the Aga Khan. And then now also just doing my endocrinology specialty, and also obesity. So I think the 3 main places in my career was just formed by the entry into the different spaces, into the different specialties that I was in. Yeah.